Hello class, today's Kaltura is going to be on interpretation of normal anatomy. Now before you go any further, I want to be sure that you're all reviewing bony landmark terminology, so make sure you either take out your skull or review some orofacial structures notes to help you. Some of the normal anatomy information that you should be reviewing are things like what prominences of the bone were, so remember what a process, ridge, spine, tubercle, or tuberosity were. Remember what the spaces and depressions in bone were, so things like canals, foramen, fossa, or sinus. Also remember miscellaneous terms. Remember what the septums were. Remember what a suture were. This will all be important in understanding what's going on when interpreting normal anatomy on a radiograph. So before we review any of these terms, I want you to remember the different types of bone. So remember that there was cortical bone and cancellous bone. So our cortical bone was our dense outer layer of bone, whereas our cancellous bone was the soft, spongy bone located between layers of the dense cortical bone. So radiographically, when you're looking at cortical bone, it's going to appear as a radiopaque area on the radiograph. So we can see down here, this radiopaque area is going to be our cortical bone, whereas our cancellous bone is going to appear more radiolucent. So our cancellous bone is here. So it's a bit more radiolucent, and you can also see the trabeculae and the marrow spaces. So our trabeculae and the marrow spaces that make it more radiolucent. So as we go over these, I'm going to be giving you both a description of the anatomical finding as well as what it appears like radiographically. This will be important for your exams as well as being able to interpret radiographs in the real world, because questions on your exams especially will be going over both the anatomy as a description, or it can also do it as a picture. So knowing both of these is going to be really important. So first is your incisive foramen. So the incisive foramen is an opening or hole that is located at the midline of the anterior portion of the hard palate, directly posterior to the maxillary central incisors. So you can see here, these arrows are outlining this ovular shaped radiolucent area. So on the radiographic, it will appear as a small ovoid or round radiolucent area located between the roots of the maxillary incisors. So right there. And visible just above the incisive foramen is your superior foramina of the incisive canal. So this is going to be two tiny openings or holes in bone that are located on the floor of the nasal cavity, and they join together to form the incisive canal. So you can see here are our superior foramina. Just above here, where our incisive foramen would be. Next, we'll go over the median palatine suture. So the median palatine suture is located just between slicing the incisive foramen in half. So the median palatine suture is described as an immovable joint between two palatine processes of the maxilla, and it's that thin radiolucent line between the maxillary central incisors. So you can find that right here. So incisive foramen, median palatine suture in the middle, and then you can see right up here, our superior foramina, our two radiolucencies up here. Next is the lateral fossa. So the lateral fossa is a smooth, depressed area of the maxilla located just inferior and medial to the infraorbital foramen between the canines and lateral incisors. So radiographically, it's going to appear as a radiolucent area between the maxillary canine and the lateral incisors. So you'll notice this here on radiographs, and you want to be sure to know what this anatomical landmark is, not because it's necessarily an incredibly important landmark, but because you want to know that you're not looking at any pathosis. This radiolucent area you may think looks like something abnormal because it appears different than the bone surrounding it, but it's important to know that it is not. If I were to look at this radiograph on my own, I wouldn't be looking at the lateral fossa. I'm looking over here. I notice here on this root canal, I definitely shouldn't be seeing this radiolucency here and then radiopacity almost above the apex of that tooth. So if I were to take this radiograph, I would definitely be concerned about this tooth. So you want to be looking at the whole picture. Next is the nasal cavity. So the nasal cavity is a pear-shaped compartment of the bone located superior to the maxilla. So you can see the nasal cavity outlined here. by these black arrows. So it's described as a large radiolucent area just above the maxillary incisors. Next we have the nasal septum. So the nasal septum is a vertical bony wall or partition that divides the nasal cavity into the right and left nasal fossae. So we have that located with those black arrows right here. So it is formed by the vomer and a portion of the ethmoid bone and cartilage. Radiographically, it's that vertical radiopaque partition that divides the nasal cavity. So we have our nasal cavity here, and then our nasal septum right here. Next, the floor of the nasal cavity. So that's the bony wall formed by the palatal process of the maxilla and horizontal portions of the palatine bone. So remember when we were going over nasal cavity, we said it was outlined by those black arrows. It's more important, however, to remember that this darker area is the nasal cavity, so the radiolucent, and the floor is the actual radiopaque area. So if it says radiopaque band just above the maxillary incisors, we're looking at the floor of the nasal cavity, where if it's described as radiolucent, it would be the actual nasal cavity itself. Next, we have the anterior nasal spine. So the anterior nasal spine is a sharp projection of the maxilla located at the anterior and inferior portion of the nasal cavity. So we're looking right here. So it's a V-shaped radiopacity located at the intersection of the floor of the nasal cavity and the nasal septum. Next, we have our inferior nasal conchae. So these are thin, curved plates of bone that extend from the lateral walls of the nasal cavity. So conchae meaning shell-shaped or scroll-shaped. So you can see they're slightly more radiopaque than the cavity located right over here, outlined by these white arrows. So they're described as diffuse radiopaque masses or projections within the nasal cavity. Next, we have our maxillary sinus. So this is an important one, especially when you're interpreting radiographs, because if you're not sure if you're looking at a radiograph on the maxilla or the mandible, remember that there are no sinuses on the mandible. So if you see the sinus, you're definitely looking at a maxillary PA. So the maxillary sinus is described as a paired cavity or compartment of bone located within the maxilla. It's located just above the maxillary premolar and molar teeth. So here again, the white arrows might be pointing to the floor, which is radiopaque, but the sinus itself is this radiolucent area just above there. So it's going to appear as a radiolucent area above the apices of the maxillary premolar and molar teeth. So again, very important one, not only for interpretation, knowing if you're on the maxillary mandible, but also in private practice or looking at radiographs as well, because obviously if the sinus is closer to the teeth, we're going to be looking at a few different problems. Next, we have septa within the maxillary sinus. So septa is described as a bony wall or partition that divides specifically the maxillary sinus into compartments. So radiographically, it's going to appear as a radiopaque line within the maxillary sinus, and the presence or number vary by the anatomy of the individual. So this will be different with different patients, but generally speaking, you can see here, this is just a septa. Here's our maxillary sinus, and this is dividing it. Next, we have nutrient canals that may be found within the maxillary sinus. So this is important to know that they can be found both in the maxillary and mandible, but they do have about the same appearance. So the nutrient canals are just tiny tube-like passages through bone that contain blood vessels and nerves. So you can see it lined here as a more radiolucent area running through the maxillary sinus. So it's always going to be described as a radiolucent band bound by two thin radiopaque lines. So you can see it's slightly radiopaque around the outside there, slightly radiopaque with a radiolucent band between it. Next is our inverted Y. So the inverted Y is the intersection of the maxillary sinus and the nasal cavity. So here you have right here your maxillary sinus and your nasal cavity, and it's called the inverted Y because it looks like an upside down Y. So it's going to be a radiopaque upside down Y formed by the intersection of the lateral wall and nasal fossa at the anterior border of the maxillary sinus. And that's going to be found just above your maxillary canine. So here's our maxillary canine. And then right here is our inverted Y. Next is our maxillary tuberosity. So the maxillary tuberosity you should be very familiar with. It is a round prominence of bone that extends posterior to the third molar area. So it's just found distal to the terminal molar. So whichever is the last molar the patient has is where you're going to find your maxillary tuberosity. Radiographically, it will appear as a radiopaque bulge distal to the third molar region. Next is your hamulus. So the hamulus is a small hook-like projection of bone that extends from the median pterygoid plate of the sphenoid bone. So radiographically, you're going to see it as a radiopaque hook-like projection posterior to the maxillary tuberosity. So here you have your hamulus. Now this is an important one not to be confused with the maxillary sinus. So make sure you understand the difference in the appearances because the zygomatic process is going to be a much thicker area than the maxillary sinus. So the zygomatic process is a bony projection of the maxilla that articulates the zygoma and malar or cheekbone. So you're looking at this thicker radiopaque band here, and it's described as a J or U-shaped radiopacity superior to the maxillary first molar region. So here on this image, you can see up here, this thicker J or U-shaped radiopacity is your zygomatic process. And then here, you can see by these lines, this slightly radiopaque diffuse band extending posteriorly from the zygomatic process is going to be just the zygoma. So the zygoma is what articulates with the zygomatic process of the maxilla. Now we're going to move on to the mandibular anatomical landmarks. So to start, we'll start with our genial tubercles. So the genial tubercles are tiny bumps of bone on the lingual aspect of the mandible. It's the attachment site for the genioglossus and geniohyoid muscles. So you can see this radiopaque area here is our genial tubercle. Radiographically, it will appear as a ring-shaped radiopacity just below the apices of the mandibular incisors. And then within our genial tubercles will be our lingual foramen. And our lingual foramen is just a tiny opening or hole in the bone located on the internal surface of the mandible. And it's a small radiolucent area just inferior to the apices of the mandibular incisors found within the genial tubercle. So here we have our genial tubercle, and this radiolucency in the middle is going to be our lingual foramen. Next is our mental ridge. So the mental ridge is a linear prominence of cortical bone located on the external surface of the anterior portion of the mandible. Radiographically, it will appear as a thick radiopaque band that extends from the premolar region to the incisor region. Often, it appears superimposed over the mandibular anterior teeth. So you can see here, in some areas, it appears just over the apices of the anterior teeth on the mandible. Next is our mental fossa. The mental fossa is described as a scooped out depression area of bone located on the external surface of the anterior mandible. So it's going to be a radiolucency just above the mental ridge. So again, when you see this more depressed radiolucent area on a radiograph, don't be concerned that it's pathosis. Make sure you're considering that it's probably just the mental fossa. Next is a very important one. So next is our mental foramen. This one is important because, as you can see, it is a small ovoid or round radiolucent area located at the apical region of a mandibular premolar. We know that when we see radiolucencies around the apex of a tooth, normally we would consider this might be pathosis. But you also have to consider when you're in the region of the mandibular premolars that it could just be the mental foramen. This is incredibly important to know. You do not want to misdiagnose the mental foramen as somebody having pathosis. This will definitely upset someone, whether that be me when you're in clinic, whether that be one of your clinical instructors, whether that be in clinic next year, or especially in private practice. You do not want to be telling your patients that they have possible disease when they do not. So make sure you always know the mental foramen. And remember that the mental foramen is an opening in the bone located in the external surface of the mandible in the region of the mandibular premolars. So mental foramen, very important one. Next, we have our myohyaloid ridge. So this is a linear prominence of bone located on the internal surface of the mandible. So located right here. So it's a dense radiopaque band that extends downward and forward in the molar region. Now we have our mandibular canal. So your mandibular canal looks similar to the nutrient canal. So we've got that radiopaque band outlining that more radiolucent area in the middle. And they're described as a tube-like passageway through bone that travels the length of the mandible. So in the mandibular canal, it's going to house the inferior alveolar nerve and blood vessels. So this will be especially important as you're taking your local anesthesia course. So make sure you remember your mandibular canal. And it's going to be described on a radiograph again as a radiolucent band outlined by two thin radiopaque lines that represent the cortical walls of the canal. Next, we have our submandibular fossa. Your submandibular fossa is described as a scooped out, depressed area of bone located on the internal surface of the mandible, inferior to the myohyaloid ridge. So it's going to be radiolucent in the molar region just below the myohyaloid ridge. So here's our radiolucent fossa, and up here is our myohyaloid ridge, that more radiopaque band. The next ones we'll have are our internal and external oblique ridges. So the internal oblique ridge is a linear prominence of bone located on the internal surface of the mandible and ramus. So it's going to be appearing as a radiopaque band that extends downward and forward from the ramus. So here you can see our internal oblique ridge. It's important to note internal and then external will be above it. So if you can see both of them on a radiograph, the internal oblique ridge will be inferior to the external oblique ridge. So we'll show you that here. So here's our external oblique ridge, and here's our interior oblique ridge. So if you're trying to remember these, which can sometimes be difficult, the easiest way you can remember it is that by saying, where is an exit or external exit sign located? It's always going to be above the door. So external or exit sign, external oblique line, is going to be above the internal oblique ridge. And lastly, we have our coronoid process. The coronoid process is a very important one. We find this often on the boards. They like to ask this question because it is a mandibular anatomical landmark that is visible on a maxillary molar periapical. So the coronoid process is a prominence of bone on the anterior ramus of the mandible, but appearing radiographically, it's a triangular radiopacity superimposed or inferior to the maxillary tuberosity region. So here we have a maxillary PA with a mandibular image. Here's our coronoid process. And that is it. All right, have a great rest of your day.